Okay, ladies and gentlemen, you are welcome. So in this video, we are going to look at introduction to radiotherapy. Don't forget to subscribe, follow, and join to my YouTube community for more videos. Introduction to radiation therapy. Radiation therapy is a medical treatment that uses high energy radiation to destroy cancer cells. So, ladies and gentlemen, when we say radiation therapy, is when you use a high energy radiation to destroy a cancer cell. And that is what you call radiation therapy. And this medical treatment, it has been used in so many places and in so many cancer treatment. So you should understand that it is actually a common, especially in advanced countries. And very importantly, we should understand that this radiation therapy, it is a common modality in cancer management. And you can use it alone, or often used alone, or you can use it in a combined therapy, where you can use the radiotherapy combined with surgery or chemotherapy. So it means that sometimes if you want to use this radiotherapy, you can use it alone to cure the cancer cells, or you can use it in a combined form with either surgery or using a drug. So this radiation therapy or this radiotherapy can be called radiation therapy, radiotherapy, or radiation oncology. So you can give it all these names. You can either call it any of these three: radiation therapy, radiotherapy, and radiation oncology. So the primary goal of radiotherapy is to eradicate tumors while at the same time minimizing damage to the surrounding healthy tissues. Because you need to understand that in terms of the use of this chemotherapy in the treatment of diseases, you need to know that you are going to expose the tumor cells with the radiation. So also at the same time, it is very important to also minimize the side effect to the surrounding healthy tissue. So it is very important to do that so that at least you will not cause any other harmful effects to uh, the healthy tissues. So it is very important. So I think you need to understand that some of the examples of these high energy radiations that are used to destroy cancer cells include gamma rays. So you can use gamma rays to kill or destroy cancer cells. And also another examples of high energy radiation, we also have X-ray. And apart from X-ray, we also have some ultraviolet waves. So all these are the examples of high energy radiation that can be used in radiotherapy for the management of cancer. So you need to know these examples of high energy radiation. We have gamma rays, we have X-rays, we have some ultraviolet waves. All are examples of high energy radiation that can be used in radiotherapy to treat diseases. So now what are the types of radiotherapy? So basically we have two types of radiotherapy. We have external beam radiotherapy and internal radiotherapy, which can also be called brachytherapy. So now this is actually the examples of, or these are actually the image showing the two different types of the radiotherapy or radiation therapy, where we have external beam radiotherapy and then we have internal radiotherapy. So I think as you can see in the case of external beam radiotherapy, it means that the external beam radiotherapy direct the radiation from a machine outside the body toward the tumor. And I think if you can clearly see from here, you can see that this is where you have the machine, and then the radiation is directing or is actually directed toward the tumor cells externally. So that is why it is called external beam radiotherapy, where the machine outside the body and then the radiation is directed toward the tumor. So that is why it is called external beam radiation therapy. But in the case of brachytherapy or internal beam radiotherapy, it involves placing the radioactive sources directly inside or near the tumor site. So you see, in the case of brachytherapy or internal radiotherapy, you are directly placing the radioactive sources directly inside the body or near the tumor sites. So what is the principles behind this radiotherapy? So actually, in the case of radiotherapy, it works by damaging the DNA of cancer cells. So that's what it does. So as a result of the damaging the DNA of the cancer cell, that will lead to the cell death or loss of reproductive ability. So that is what happened. So in the case of the radiotherapy, the major principles behind radiotherapy, you are exposing the radiation directly to the tumor site where the radiation destroy the DNA of the cancer cell, and that will lead to the death of the cancer cell or the loss of the activity of the loss of the ability of the cancer cells to reproduce itself. So you can do that by killing the cells through cell death, and then or you can do that by making the cancer cells to lose their reproductive ability. So then, of course, the effectiveness of this radiotherapy depend on some factors. And some of these factors include, as you can see, radiation dose is one of the factors that need to be considered while trying to manage the cancer. And then also fractionation schedule is very important, as well as the tumor type. So these are some of the factors that defend or that are trying to indicate the effectiveness of radiotherapy. So as you can see, this is actually a cancer cell. And from here, this is the radiation where the cancer cell are exposed to the radiation. And then, of course, as you can see that there is actually a cell destruction. So the cell will be destroyed. So that is what actually happened in the case of radiation therapy. So radiotherapy or cancer treatment illustration in a cell. So once we expose them, then those cells will now destroy. So then the next thing, of course, you need to understand that normal tissues tolerate limit necessitate careful planning to balance tumor control and side effects. So it is very important to know that actually, as you are trying to treat or destroy the cancer cells, so you need to understand that the normal tissues or the normal cells that tolerate a limit, a limited radiation. So therefore, there is a need for a careful plan in order to balance the tumor control and the side effect. It is very important. So what are the equipment and techniques? So modern radiotherapy employs advanced equipment like linear accelerators and image-guided system. So these are some of the modern radioactive techniques where you link your equipment with linear accelerators and image-guided system for effective treatment. And techniques such as 3D conformal radiotherapy, IMRT, and stereotactic radiosurgery enhances the targeting accuracy of the disease. So see, this is where we have the linear accelerator, as you can see from here, and then you need a targeting system because you need to be guided. You need to be guided so that at least you'll be able to directly expose the tumor cells for the radiation. So it is very important. And that is why you even have an image guided system, especially in the case of internal radiotherapy. You need an image guided system so that to move around the body, to guide the healthcare practitioner on exactly where the tumor is. So that is why the three conformal radiotherapy, the IMR and stereotactic radiosurgery, they are very important in enhancing the targeting accuracy of the disease. So these innovations allow for higher doses to tumors with reduced exposure to healthy tissues. So because if you are guided to exactly where the tumors is, of course, it will enhance the accuracy, and it also reduce the exposure to the healthy tissue. So it is very important. So the side effect and management. The common side effects of radiotherapy include fatigue, skin reactions, and localized tissue irritation. More serious effects might involve organ-specific damages depending on the treatment area, and therefore supportive care and personalized treatment planning are essential to minimize adverse effects. So you need to understand at the same time, ladies and gentlemen, this radiotherapy has a serious side effect. So it is very important to understand how to avoid organ-specific damage. And some of the side effects, as you can see, it includes fatigue, skin reactions, localized tissue irritation, and in the case, sometimes it can also lead to organ-specific damages. And as you can see from here, the common radiation side effect, as you can see, that the radiation effect are location, depth, and time frame specific. So location, where are the nearby structures? So you need to identify that. It is very important. Okay, this is the organ that you are trying to target. So where are the nearby organs? Depth. Is this radiation, is the radiation therapy shallow or depth? You need to understand that, because there are some shallow treatment or a deep treatment. So understand the precise location, especially in the case of and then supportive and care medicine is very important. So some of the organs that can be affected include brain, breast, abdomen, and lungs. All these are some of the organs that can be affected in the case of side effects. So that is why it is very important to make sure that you carefully plan